you all very much for having me here. I really appreciate the chance to come and talk about this topic, which is probably the one I'm most passionate about. And it is true. Oh, yep.
It's hard to hear you.
It's hard to hear me. Let me see if I can. Is this better?
Yeah.
Okay, I'll have to stay real close to it then.
Okay. You can take it off in the stand if you want.
Oh, yeah. Because I usually move, so. I promise not to sing. Let's see if we can do this. If I accidentally drift away, just wave, and I promise I'll. Okay. I don't have any financial conflicts of interest. I always do tend to disclose them. My role, in addition to my university roles, I am also on the Johnson County Board of Health, so public health is also a very important topic to me. And I really do believe in data and data-driven actions. Not all data really should drive an action, though. That's this cartoon where the business people are correlating sales with shaved heads. Not all studies need to be done. Anyway, and I am passionate about vaccines, so I think you'll pick up on that. This is our outline for where we're going to go tonight. Don't worry, we're not doing it all. I had a really hard time putting this talk together because there is so much stuff that we could talk about. And I really don't want to just make up in my head what I think you want to know. So there are a few really important topics. I'm going to sort of introduce the topic of vaccine hesitancy by sharing my nightmare with you, which is measles, and a little bit about where we are right now. Then I'm going to take a couple minutes and talk about the announcement approach, because this, if you do nothing else, go ahead and go to sleep now, wake up in the middle when I get to the announcement approach, and then go back to sleep, you're fine, because that is the single most important thing I have to share with you tonight. Then there's so many myths out there, and so many different ways to approach myths, that I thought we would do this sort of a choose your own adventure. I haven't done this in a talk before, so, we'll see how it goes. But once we get to this point, I have a bunch of topics here. Does this like make an arrow too? Oh, look at that. Can you guys see that? A bunch of topics over here that we can choose from, and we can go back and forth. Okay? And because I want to give you guys what you want. Okay? So we'll get there. We'll see how it goes, and if it's not working out for you, I'll just pick a few. Or, never, like I said, never done that before, but I think that this is really something that we can do. And I am not a very formal person, and so hopefully we'll have a chance to have a little bit of fun along the way. So this all starts in October of 2014. Remember the innocent days of October 2014, when our biggest global infectious disease concern was a little Ebola outbreak in Western Africa? Yeah, okay. I kind of remember that. It's way before my PTSD set in. And my dad calls me, and he says, should your mom and I be worried about this Ebola outbreak? No. What, really? Yeah, you don't need to worry. But it's only a plane ride away. All the news says it's only a plane ride away. Which is true. Yeah, no. Then ensues a brief conversation about healthcare inequities, timing of symptoms versus transmission, R naught, which was a term I used to have to define for people, and that kind of thing. And my dad's an intelligent guy who gets it, so he pauses and he thinks about it for a minute. Says, okay, well then, what do we worry about? Measles. Back then, even. Measles. What? Measles? Yes, measles. Isn't there a vaccine for that? He said. Yes, Dad, there is an incredibly effective vaccine for measles. Effective, not effective, sorry. There you go. An incredibly effective vaccine for measles. In fact, the World Health Organization between 2000 and 2020 estimates that measles vaccine alone prevents an estimated 31.7 million deaths worldwide. I feel like I shouldn't have to say anything else. I have to say thank you very much. We could have dessert, but of course that's not how it goes. So there you go. So in measles, again, I don't think I needed to define R naught for you, but to remind you, because this is going to matter later. R naught, if you have one infected person, is the average number of people who will be infected from that person if your entire population is vulnerable. That's going to come up later. Okay. So the OG, the original strain of COVID, had an R naught now we think around 3, right? Remember then to like halfway innocent days when we went from the OG to the Delta strain, and we're like, oh man, this is contagious. So that R naught was around 7, right? Measles R naught is 18. Not only that, but it depends on how you count, but probably somewhere between 4 to 5% of people with COVID got hospitalized. In the US, 25% of people who have measles get hospitalized. It is literally big. Okay, so, and not only that, but we're having trouble. So here we are, and in the 2000s, and in 2000, measles was declared eliminated in the United States, right? Also, shouldn't have to say anything else, we're not in the sector. What that means is there's no actively circulating measles that we know of here. All of the measles outbreaks here start with a traveler bringing measles back into the US. That may or may not remain the case, but at the moment, that's where it is. And so here we are in 2000, and we have a number, and the y-axis here is the number of outbreaks, not the number of cases. And we had some outbreaks, and then we were doing okay, and things were kind of heating up, and we'd have an okay year here or there, and we'd be like, oh, we're fine, but we're not fine. And then here's 2019, right here, this tall blue bar, right? Okay, there you go, another innocent day when we worried about measles outbreaks in Disneyland, right? And then, no big deal because we fixed it, right? 2020, no measles outbreaks. Because remember, measles outbreaks come from people traveling someplace else and back here. And in 2020, innocence is gone and the entire world stops traveling. So yeah, you can actually stop measles by not going anywhere, but that's not what we kept doing. And right now, we're in the midst of a year, this gray part of the bar is the estimate for the year, because the epidemiologist's little secret, right, is you can never actually know where you are right now, because you're still acquiring data. But 2024 is a banner year, not one we want. And this is why. So this is the WHO map of Europe. It's a little different than the maps in our history books because it's a WHO map, not a US-centered map. But I think if you look over here, you'll recognize the piece of Europe you recognize, and that's Greenland. And so here you go. So red is bad. Dark red is really bad. And in 2022-23 season, there were 9,821 reported cases of measles in the European region of WHO. In the 23-24 season, it's 132,000. So we go there, our vulnerable patients go there, they pick up measles, they bring it back, it causes outbreaks, here we are. And if you actually look at the numbers, and I want to encourage you to think about this, if your patients are traveling, do not worry about your patients that are traveling to Africa. Worry about your patients that are traveling to the UK. Because the #1 country for importation of measles cases to the US is the UK. It's not this bright red blob over here, because more people go to the UK, right, than go to the blob. Anyway, and here we are now, right? So my dad's like, oh, Ebola is on the plane right away. That was the news always said. I don't know why they fixated on that, but they did. And here we are. These are the cases as of October 10th. These maps always change. And you know, you can find us on the map probably better than I can. But I would make the argument right now that for you guys.
Sorry, I don't want to interrupt.
Yeah.
With the new cases, are they pediatric and adult, or just all combined?
You name it. Yeah, so somebody travels, it could be a family that travels and a kid brings it back, or it could be an adult who brings it back. And then there's sort of a number of vulnerable people in the community. And then it's off to the races. Mm-hmm.
You use the term outbreaks.
Mm-hmm.
How is that defined?
Okay. So the CDC does that, and it's really defined by a geographic and temporal clustering of cases. There's not enough measles in the US right now to have much trouble with that. They don't usually overlap. You can usually tell that there's a particular area together who are all under-vaccinated. And so that usually creates a ring of well-immunized people around that, and that defines the clustering. It's not always that straightforward, and we're kind of on the edge there, so hang tight. Anyway, I would offer you the lovely nightmare thought that now, for you guys especially, but for all of us, measles is a bridge away. Forgot the plane. Okay, so here's a fun and useful, this is my first fun fact, it's also useful. If you do have patients who are traveling, typically we say you don't give measles vaccine before 12 months old. We can talk about that later if you want to know why, but it's safe, plenty safe, to give it down to 6 months old. So if you have a person who's traveling with a young child, 6 to 11 months old, and they're going outside of the US for sure, and if you know they're going to an area in the US where there's an active outbreak, I would say that counts too. You can actually immunize them. 6 to 11 months is totally okay to immunize them. I would warn their parents that they're gonna have to get a second and third dose rather than 2 doses, because in order to make kindergarten requirements, they have to have 2 doses after they turn 12 months old. But I would laud their parents for wanting to get that vaccine and keeping their kids safe. And if a 12-month-old or older is not yet immunized, you can actually get them caught up or actually ahead of the game, because if they're traveling and you have enough time before the trip, you can actually give them both doses before they go, and that's best case scenario, because to really have best efficacy from measles vaccine, you need 2 doses. And the catch-up routine is that if there's 28 days between the doses, that's fine. Right, so it happened to be like an 18-month-old who hadn't had any vaccines and they're traveling for 6 months, you just give them 2 now. Perfect. So there's your first fun fact. Okay, so current state of childhood immunizations. My dad actually emailed me these cartoons. I don't know why this talk always makes me think of my dad, but it does. I've never seen a New Yorker cartoon before that had color. I don't know if any of you had, but this one was very impressive to me because of that. And you see the doctors standing here, the worried parents, the kids covered in red spots, and the New Yorker caption was, "If you connect the measles, it spells out my parents are idiots." That may be true. When I'm feeling kind, I would cross out the idiots and write in instead, living in a difficult world. Because I think that's probably more true. So here we are in Iowa in 2023. Here's our current vaccination status. This is the Iowa state data. And this graph is the number of 2-year-olds in Iowa who completed the recommended vaccine that you would get by the time you turn 2. And you can see we're doing a banner job and immunizing just over 2/3 of our patients. And you want to make it even worse, here's MMR, that's 82%. Why does that matter? Well, experts estimate that to get to herd immunity, you need a 95% immunized population. 83% is not going to cut it. So you asked me about how you define an outbreak. Right now we can, but it's a very good question, because I don't know that we're going to be able to stay that way in terms of defining those things. This actually, I added this morning. All this data, if you're an epidemiologist, all your slides get updated regularly because the CDC keeps sending out new data. They sent this out this morning, okay? This is the number of jurisdictions, in other words, states, that could not possibly get to 95% coverage for their kindergartners based on the number of kindergartners who have vaccine exemptions. So if you have a higher than 5% rate of vaccine exemption in your state, you can't possibly get your kindergartners to herd immunity, right? And you can see what happens over time. We were getting better, boom, PTSD happens, and things get worse. I apologize, because this was supposed to be like one of those appear moments, because the data that's underneath this graph is the Scott County data. Yeah.
I'm just wondering with that previous slide, it seemed like the capture, the one before that, that one right there. So Hep B, they get in the hospital, they get, basically like the younger they are when they get it, the higher the immunization rate. So is it something about parents rejecting the specific vaccine, or is just the fact that they're in the doctor's office more, they're more consistent when the baby is younger? And if the vaccine schedule were changed to make the MMR at 6 months standard, if that would make a difference?
Yeah, it might. In addition to the parents being more worried about their their kids, I don't know, open to vaccination. I have no idea what that is, but there's absolutely that psychological phenomenon, it's very true. And in addition to that is those frequent visits. Even if you miss one, you have more chances to catch up, right? So unfortunately, the 6 months old is where those frequent visits tend to tail off. So I don't know how that would fly, but that's an excellent idea. But yeah, so there we go. Anyway, underneath here is the Scott County data, and I can tell you that the Scott County data is almost identical to the state data. So anyone who wants to see this later will peel off this new graph and show you that your own data. Oh, it showed up backwards. Sorry. Excellent. Okay, here's your data. The 4313314 is the series of recommended childhood immunizations by the time you turn 2, and Scott County is at 69.8, which is 0.2% better than state, and your MMR rate is 80%. And this is the 2-year-olds who, for each different vaccine, this red line right here is the measles line, which looks great until you hit this point when everything starts to head downhill. We need to turn this graph around. Not just you guys, all of us. I would, Johnson County's not any better, I promise. So fun fact, who issued the first US vaccine mandate? Just think about it for a minute. And I will tell you while you're thinking, this is probably a misstatement. I probably shouldn't have said US, I probably should have said North American. General Washington. Yeah. So 1775, 70, that's why I said she should say US, because we weren't actually the US yet. 75, 76, 90% of the deaths in the Continental Army were caused by infectious diseases. Forget the British, right? So what was one of the things that was happening, one of many things that was happening is smallpox, right, is one of those things that was really part of everybody's life. And in Europe, they all were very tight on top of each other. And so by the time a British soldier made it over here, they probably had already had it. So the ones that were alive to become soldiers, they lived through the smallpox in their childhood, are now immune. So the British Army's mostly immune, right? The US did not have that effect. We were so spread out. So a couple things happened. First off, all the people who come over with the British soldiers, some of them bring smallpox with them, so there's more circulating smallpox than there was before. And we put all our soldiers together down at Valley Forge on top of each other, right? So you can imagine how that went. And Washington's looking at this, and literally his guys are dying left and right of smallpox. And in 1777, he mandates that if you are a Revolutionary War soldier, you must be inoculated for smallpox. It was no small thing back then. That was not the world's safest way to go, but it was definitely still already way safer than getting wild-type, normally acquired smallpox. And there are a lot of historians out there who credit him winning, or well, not him, but they credit him for doing this and say, had he not done this, we would all be a British colony still. No joke. I mean, literally, they think that this was one of the ways we won the war. Okay, so now we have to talk about changing our own minds. So we are supposed to change. And so here's my status slide for the whole talk. So this study in 2022 surveyed a bunch of primary care providers, pediatrics, family medicine, internal medicine, and asked them with a Likert scale. So it's that 5 is strongly agree, 4 is mostly somewhat agree, 3 is neutral, and on down. Okay. And all they asked them was, do you agree with the statement? Vaccines are safe. Do you agree with the statement? Vaccines are effective. And finally, vaccines are important. Okay. So in blue is the data from the primary care providers, and this is 90%. And I put together strongly and somewhat agree, so figure, so 90% of surveyed primary care providers are willing to say vaccines are safe. Either I strongly agree or I somewhat agree with that statement. It doesn't get any better for the other questions. And that means that between 10 and 11% of PCPs are either neutral or do not agree with that statement. Which, this is my response. Right, I can't show this slide without getting all goosebumpy. It's not terrible news though, because look at this. Look at the orange bar, that's US adults, right? So US adults, if you look at important, 87% of the US adults say vaccines are important. That's it's not the end of the world. But we've got to do some work ourselves right? Before we could really ask anybody to do anything else. But it really isn't as bad as we think. So people who study vaccine hesitancy group the hesitant people into different categories. And I've kind of color-coded things, and I made a bar graph over here that I'm not standing in front of, so over here. The biggest category is actually the unquestioning acceptor. That's me, right? If I'm in your office and you come near me with a vaccine, I roll up my sleeve, right? Anyway, so 30 to 40% of people, right? We think of this as everybody, right? It seems like it's always happening that they will get vaccinated. But it's really 30 to 40% are completely accepting. And another 25 to 35% are what we call the cautious acceptors. They have minor concerns, but as long as you can allay those concerns, they will absolutely vaccinate their kids or themselves. 20 to 30% then in this blue group over here is hesitant. They have significant concerns, but they trust their doctors, and the chance to discuss the concerns is usually enough. So a good conversation here will get those folks vaccinated. In purple are the late or selective vaccinators, and that's 2 to 27% depending on how you count them. And they have serious doubts about safety and some doubts about necessity. And they are often the most highly knowledgeable group. Some of these people know some of these studies better than I do, right? And they're the ones who are going to have a really long conversation with you. It is possible to have these long conversations and get these folks vaccinated. They're not a refuser, but it's going to take a lot of work. The advice on when you meet those people, my advice is schedule them for one of those consultation appointments. Say, why don't you come back at the last appointment of the day for me, right? You get as much time as we need. Let's sit down, look at the data, talk it over. Tell me what you need from me as far as information. Let's have that talk. And it's really less than 2% of people who are flat out refusing. And my advice for them is, well, you'll see it as we go by, but don't get sucked in, right? Spend your time here, right? And if nothing you can do to make a difference, you know what to do. Okay, so here's the next fun fact. This is really the funnest fact. It's not actually fun, but it's cool. So the CDC surveys parents, and this was in 2018, and things may have changed a little since then. But they asked them, who is the most trusted source of vaccine information for you? You. Look around, it's you. 93% of parents said their most trusted source of vaccine information is their primary care provider. So it's not hopeless, right? People know that we have good information, they know they have worries, and they know where to go to get the info, and we can make a difference. And I think most of you maybe are old enough to remember the Smokey Bear campaigns, only you can prevent forest fires. Right? Only you can do this. I can't do this, right? I'm not their primary care provider. I don't have that relationship with them. I can support you while you support them. I'm all in. And at the time, social media, 18%. Now you could say, well, COVID changed everything. It probably did, but not that much. In 2018, there was plenty of social media going around. So I don't think this is really a lost cause. So, but your approach matters. If you're me, right, this is how I used to approach it. I'm not blonde, but you get the idea. Are you willing to get vaccinated against a potentially deadly disease? It's awful. It's my nightmare. Measles, right? And the patient appropriately responds, I'd rather die, right? And so that was usually the way I did it, and it turns out that's not the most helpful. And in fact, I used to think, gosh, if I could just share this information with people, they would just run to be vaccinated. And so here's a 1901 picture from Dr. Alan Warner. These two 13-year-old boys they had the same exposure to smallpox. They were both in the same place, getting exposed at the same time. One of them was vaccinated and one was not. Guess which one? And I used to say, this picture, and a picture of iron lungs, and a picture, right, like that's gonna do it. We need to make sure people understand how bad it could be. They just don't get it. And here's what the actual answer to that is. Right? So the great sage Yoda, or whoever wrote that script, right? Fear is path dark. Fear leads to anger. This is true, right? The reason that we all like Yoda is because he was just telling the truth, man. Fear leads to anger. Anger leads to hate. We see that all over social media now. And hate leads to suffering, no question. Right? So what's going on? I am not, I will warn you now, I am not a decision-making psychology expert, but I work with them. And they've been teaching me, and I've been learning. And I put this slide together, and I had them look at it and make sure it sounded okay. So this is like a once removed slide about psychology of decision making, but you get it. It's extended parallel process model. So in the extended parallel process model, there's actually two parallel processes that are going on in the decision to vaccinate or not. Before you really enter that parallel process, you start here, and you have to think here, are these diseases a problem? Right? Because if the answer is no, the diseases don't happen anymore, it's not a problem, I'm not worried about it. That's not a big deal, right? If they aren't here anymore, it's like smallpox, right? Smallpox is eliminated. We don't need to vaccinate. I agree. We don't need to vaccinate for smallpox. Thank goodness for all the people who work hard for that, right? Okay, but if the diseases are still a problem in any stretch of the imagination, this is where the parallel process comes in. Because you have two parallel assessments that happen at the same time. One is, what is the perceived threat? What is the severity of the threat, and how susceptible am I to that threat? Okay, so that is one side of the equilibrium. The other side is perceived efficacy. How effective is the intervention? How feasible is the intervention? You notice it doesn't say how safe is the intervention. This is really about, can I make a change? Is it going to work out for me to make this change? And it's a teeter-totter, right? So the problem is that with all the social media misinformation out there, we're overweighting, before I get there, if you dip this way, right, the response is fear. And fear is an emotion. Fear leads to anger, anger leads to, yeah. It's an internal response to a negative emotion. And people respond to fear, you know it, right? Denial, defensiveness. Efficacy is not gonna matter if these people are in their emotion. This is not a rational place, right? On the other hand, if you can balance out to efficacy and give them the power to make things better, you can get into their heads in a nice way. You have the external response to the threat, right? So that the threat is outside, they can handle it, they're thinking, they want to know what behavior or action, and they want to do, they want to act. They're not going to withdraw. Fear is withdraw. Thinking is act and fix the problem, right? So we need to keep people over here, which means that all my pictures of are not actually needed. And the problem is that with this, all the social media stuff, I started saying, we're overweighting over here. Because not only now do we have the threat of disease, we have the threat from the vaccine. Well, we don't actually have a threat from the vaccine, we have misinformation about the threat from the vaccine, but that's good enough to cause a threat response. So we're overweighting over here. And what I really need to be doing is not pictures of kids who were exposed to smallpox, but it's over here. See, this is kind of it looks like me, right? Like, I just need to be out there. Vaccines are safe and effective. Vaccines are safe and effective. Vaccines are safe and effective. Vaccines, right? Like, but in a catchy way so people actually pay attention. That's what's going to get us there. Okay. So that's the decision-making process. And there's actually data to support this. If you actually give people information like this little summary for the adverse event report that says, you know, in 2013, there were 7 deaths that happened after HPV vaccine, maybe or maybe not related, and 24 disabilities for 10 million doses. Right? So they gave people that piece of information. And so if they gave standard care no extra information, they got this much HPV vaccine going in arms, and they give them this summary data, it increases, even though it sounds kind of scary to say this made deaths, right? But what they're saying is 10 million doses versus 7, right? That's where you're empowering, you're saying this is effective, you can do this is a feasible thing for you to do, and it increases vaccination. If you give them the whole VAERS report, where it talks in detail about all the different reports, you can forget it. If you give them this VAERS summary in the vaccine information sheet, which is that CDC sheet that we're supposed to give everybody by law, we're required to give it, remember, yeah. They actually, not only do they increase vaccine uptake, but the surveys also found they increase their trust in the CDC. That doesn't suck. Okay, so here's a very early anti-vax cartoon. This has been a problem for a very long time. One of my favorites. So it's 1802. The caption across the bottom reads, "The cowpox, or the wonderful effects of the new inoculation." So here's Edward Jenner here, right? And you can tell because he's got his assistant here who has a bubbling vat of vaccine concoction, and he's got a scalpel, and he's scarifying this poor woman's arm, and they're about to pour the boiling acid vaccine onto it. And all these other people here have been vaccinated already. And you can tell because they have cows growing out of their body. Right, because this is when the vaccines are named after vaccinia, which is cowpox. And that was Jenner's discovery that cowpox didn't give humans bad disease, but it immunized them from smallpox. So that, it's been going on a long time, this fear. And so what can you do? The answer is the announcement approach. Now, if you fell asleep, because I told you could, it's totally okay with me if you did, now is the time to wake up. This next couple of slides, this is what you can do. This is, if you're not already doing it, you can change. If you are doing it, yay, and you can do it even better, okay? Because this is what's gonna get people vaccinated. Of course, if you're me, and if I could actually make it happen, then I could make all the waiting room chairs just subtly vaccine. All right, I would get arrested, but people would be vaccinated, and it'd be a trade-off. Okay, announcement approach. In my house, whenever somebody says, I'm gonna totally do this, we sing, and I won't sing, I promise. But if any of you remember the movie Trolls, like this character Poppy, like her people were being eaten. And so she had to go out and leave the only home she'd ever known, brave the dangers of the forest, saving them before they're eaten. I mean, how hard can that be? Right? And the catchy song, the how hard can that be part is a really catchy part of the song. And so that's what we have as our little family meme when somebody's sort of talking way up there, right? How hard can that be? It turns out you can do it. Just remember Poppy, she could do it too. So the announcement approach. This is one of the early studies that demonstrated this. What they did was they went to primary care provider pediatrics offices and talked to parents who were sitting in the waiting room getting ready for their 1 to 19-month-old to have a healthcare supervision visit. And they asked them some questions, determined their level of vaccine hesitancy. They dramatically oversampled for vaccine hesitant parents. They wanted a lot of hesitant parents in the sample. So when I show you the numbers of who accepted and rejected later, don't panic. Because these were actually people who were already on the side of rejection before they got in the room, okay? And they got their permission, and they videotaped all these visits. And then they looked at what the conversation did, and they analyzed it, and this is what they found. So, how does the provider initiate the vaccine recommendation? And this study called it the presumptive approach, now we call it the announcement approach, that's the same thing. So in 74% of the time, the provider gave this presumptive announcement approach. And this announcement approach is exactly what we were taught not to do in medical school, right? We don't tell our patients what to do. We have a conversation with them. We have shared decision making. We are good listening providers. It is a negotiation. It's a learning moment. It's a whatever, right? Don't do that. This is the hardest thing I ever don't do. Really, I meant it that way. And try it. It's really hard, right? Because we've all been working to be as good of a listener as we can forever. And the announcement approach is you just tell them what's going to happen. Yeah. So Alex is 11. That means that we can give Alex an immunization that will protect them from 6 different kinds of cancers today. And actually, I still didn't do it right because I said we can. You don't even do that, right? Alex is 11, that means they're due for a vaccine that will protect them from 6 kinds of cancer, right? It takes a lot of practice. So if you do that, so 74% of the providers did do that, 26% of the people resist. If you do the participatory, like this is how we were taught, so what do you want to do about vaccines today? It's time to talk about vaccines. What are your thoughts? All this stuff that sounds like good medicine, right? 83% resist. There it is. Okay, if you want to, you can go back to sleep. We're going to talk a little bit more about it though. And here's the coolest next part. So what does the provider do? Now, you didn't have to do a study to measure this part. The provider says, oh, okay, we won't vaccinate your kids. Then obviously there was no vaccine because they said okay. But on the other hand, if the provider offers some sort of compromise plan, an equal number of kids don't get vaccinated. So compromise isn't where it's at. If the provider pursues the initial plan, really, I really strongly recommend this. This is the best way you can take care of your child, right? Then, and that was 19 people had gotten down their little tree to that. Then half of them got vaccinated. Literally. One sentence. No, I don't think we'll do vaccines today. I strongly recommend this. This is a really important way to protect your child. Oh, okay. Done. Done, right? Awesome. Okay. No more pictures of kids with smallpox, Melanie, just push it. Okay. the announcement approach, just to kind of go into this in a little detail, if you're not already doing this, if you are, awesome. You state the plan. There's actually research on this, and the best way to do this is if it's a kid, you start with the age. If it's an adult, I'm guessing you don't start with the age. I hope my provider doesn't start with my age. Anyway, but if it's a kid, you do. You state the plan, you start with the age, you focus on prevention and on the disease, not the vaccine. And I just got done telling you not to talk about the disease. It's actually a different version of talking about the disease. Okay, so it's a statement. Marcus is now 9, so today he'll get a vaccine that prevents 6 HPV cancers. It prevents cancer, right? Today he will get a vaccine that prevents cancer. So much better than pictures of smallpox. Okay, you do that. You connect and you counsel is a second step. So you don't actually have to be a bad doctor. No one's going to report this to your medical school. You just do your motivational interviewing, your participatory conversation second. You just do your announcement approach first, then you connect and counsel, right? So you still get to say all your good things, and then at the end you try again, right? That's Poppy, right? Like you just no, I need to say this to you. This is really important. I strongly recommend this, right? And that's where you get that extra half. Okay. So announcing sets the norm. It gives people a strong place to sit if they're in those hesitant categories. And then, and it focuses on disease prevention. So remember me over here, vaccines are safe and effective, right? So it's the disease prevention me, it's not the smallpox me. It's not the gross pictures that you don't want to see at dinner. They're safe and effective, safe and effective, safe and effective. And then once you've given that statement, it's really important to do everything that you were taught in medical school about silence, right? Do not turn that statement into the cave. So we're gonna go 3 shots today. Or is that what you wanna do? Right, that's the cave and that does not work, right? So we're gonna do 3 shots a day. Listen, wait for their response. It might take a little while, okay? And then after they respond, and again, it takes practice, then you get into it some more. And you really have to practice these statements. Remember, you know the age, you know what they've got. Now that these are the vaccines that we will give Riley today. Now that Avery is 11, they are due for 2 vaccines that will protect them from 4 diseases. Yeah, it works. The connected counsel part, you almost certainly already do this, I'm not gonna dwell on it, but that's where you do your motivational interviewing, your what else are your concerns, what else are your concerns, are there any other concerns? And then you validate their concerns and you address them. And you show urgency, and you can use storytelling, and you can use whatever it is that works for you. And then you try again. Right? And then if it's still a no, you can set up a counseling appointment to talk about it more. If it's still a no, let them know they can always change their mind. And then the picky detail, infectious disease provider me always has to say, except for rotavirus, right? There's a deadline past which you can't do rotavirus vaccine. So if they're due for rotavirus, you may need to mention that. But they can always change their mind. You're not going away. Just because they said no now doesn't mean that that's their only chance. And then make it, no matter what they said, make a plan to discuss it again at the next visit so they know, we're gonna bring this up again. This is really important. I want you to know, it's so important, I'm gonna ask you again next time you come in. Okay. So some presumptive pearls. Know what the kid's due for before you walk in the room, or the adult. Sorry, as a pediatrician, the kids are stuck in my head. If you don't know what they're due for, how important could it possibly be? And then, yeah, that's probably the biggest one. We talked about don't revert back to participatory too soon. Don't make it a question. Tone and body language matter, right? So you don't want to be typing the computer trying to figure out what they're due for. You want to be doing their, Alex is due for vaccines today that will prevent cancer. Eye contact, body language. These are the parts you already know how to do. Okay, and then even if they voice resistance before, you still use the announcement approach. All the other people in the office, staff, medical assistants, all those people, they can do the announcement approach too. And if somebody in your staff came out, oh my God, they totally don't want to talk about vaccines, you still do the announcement approach, right? It still works. And I remember when my daughter was 4, and those of you who aren't pediatricians and don't have kids, 4 is that first big gob of booster shots, right? There's a gajillion of them. right? She's 4. We do her health supervision visit, everything's good, and then her primary, and the nurse comes in to do the vaccines. She's got the vaccines in a tray, and she comes into the room like this, trying to body block the site of the shot, and she says, "I'm here to do your vaccine." That moment, I realized we have a big problem. This is a moment to celebrate. This should be, I am here to make you healthier. Or not make you, but I'm here to help you make yourself healthier. Because it's their immune system that's doing the work, right? And this is this thing, like this. So from this moment on, I made a point of every time this would come up, mentioning how much healthier they were when they walk out of the office than when they walk in. To the point where I was in bed, very much in bed, after my 3rd COVID vaccine. Like covers over my head in bed. Ibuprofen's not even cutting it. My daughter, who was 12 at the time, comes to check on me. How you doing, Mom? Remember, Mom, you're healthier than you were yesterday. Vaccines are safe and effective. Vaccines are safe and effective. Vaccines are... Okay, now we're at the choose your own adventure part. Okay, so we got some things. We got some strategies for debunking myths. Vaccine delay and timing, missed opportunities. I have a good chunk of slides about the vaccine safety system because that seems to be the questions I'm getting a lot these days. The first couple of them, I will warn you, are kind of dry. But then we can go through 2 pieces of history that I think really kind of get at how good our vaccine safety system is. Too many needles, too many antigens, that's another one I'm here to talk about. Other people will immunize their kids. That works. A couple of brief slides, and then I also just have some fun examples of pushback on social media, so it can be done. So, anybody have any requests? If you don't have a request, then we'll go by show of hands. All right, who wants to do debunking myths? Couple people, okay. Who wants to do vaccine delay and timing? Oh, by the way, if you don't already have these slides, they're going to get mailed to you. So whatever we don't get to today is a resource, and even after the end of the talk, there's like 5 or 6 resource slides because there's a lot of resources out there that can help you. Too many needles. Glad you're good with that. Too many antigens. Okay. Other people immunize their kids. And then, all right, we'll try and cover some of these. Okay, let's start with debunking myths. Myth debunking strategies. Here's a 1930 cartoon with a bunch of guys on top of the misinformation cliff, and they're walking right into the smallpox ocean. And here we got anti-vaccinationist, and he's blinded by prejudice. This is fattest. It must have been a 1950s word for church. Mr. Careless or Fearless, I'm never sure which, and anti-everything. And these guys all have dark glasses, and they're all about to fall into smallpox. There you go, 1930s. Okay, misinformation. Misinformation is defined as the false information that is disseminated, regardless of intent to mislead. So the important part there, it's disseminated. Misinformation is stuff that is being put out there all the time, okay? It doesn't have to be on purpose to be bad, but it's bad. And the problem with that is what's called the illusory truth effect. The objective truth is less important than familiarity. You see this all the time. In your own lives, in your patients' lives, if you have kids, you definitely see it in your kids' lives, right? No, they're really the same pasta. They come in a different box, right? 4-year-olds still won't eat it. Okay, so repeated information is more likely to be judged true than novel information. And that is true no matter what the source is. And if even you show somebody the source is unreliable or blatantly lying, the repeated exposure still wins. This is the season of this happening, actually. How many fact checker things happen after political debates, and it doesn't matter. Like, they can show you all the data whatsoever to show you that this was actually a complete blatant lie, and people don't care. But it's not that they don't care, it's just this is how we're wired, right? So there's illusory truth. The more often you hear something, the more likely you are to take it as truth. Vaccines are safe and effective, vaccines are safe and effective. Okay, yeah. And then continued influence effect. Misinformation is super sticky. I love thinking about it that way. Somebody else, I borrowed most of this from other people, by the way, and the references from most of them are here. This debunking thing actually comes from the climate change people. Believe it or not, the climate change people had a few myths to debunk themselves, and they got good at it. Anyway, so fact checking and corrections might appear to work, right? But misinformation continues to influence people's thinking afterwards, right? So you're gonna have to debunk early and often, right? Because that stuck misinformation from hearing it 10,000 times on social media is gonna come back to be a problem. Okay, so pre-bunking, right? And when they talk about pre-bunking, this is the climate change people, but I love that they did this. I didn't do this, and it's not a pun intended. They use the inoculation analogy, and it's true, right? So I actually had a friend call me up one day, and she's pregnant with her first kid. She calls me up, she knows what I've done. She goes, so I have a question for you. Yeah, I kind of need your doctor friend hat. I'm like, my doctor friend hat? I'm not sure there's, okay. Which of the immunizations are important? All of them. Well, which ones are really important? All of them. Well, which ones do we need to do first? All of them. Well, but most of these diseases really aren't out there anymore. So which are the ones that we really need to protect them from what they're at risk for now? All of them. And I said her name, which I'll try not to say. She's not in this state, but if I accidentally say it, it's okay. But I said, what is going on? Like, she's an intelligent person. She's actually an EMT, right? I mean, like she knows, she's like, well, there's so much stuff out there. And I know that you can't believe what you hear, but it's one that there's smoke, there's fire, and I just need to know, I'm sure the fire is really tiny, but I just need to know where the fire is so I can avoid it. I wish I'd had this line then, because I learned it later. But here's the answer, right? Like there's where there's smoke, there's fire. It's one expression we use in our culture. There's another one we use though, right? He's just blowing smoke. Right? Social media is blowing smoke. You can actually, if you start talking with people early on enough about this, inoculate them against misinformation. You can point out to them, myths are easier to find than truth. It's just the case. In social media, you can talk about people blowing smoke. You can talk about social media as one giant smoke machine, right? And if you give them that ahead of time, they're more likely to, even though they hear it a lot, that misinformation gets less sticky. So, and another great line is, does influencer so-and-so care more about your child or the number of likes they're getting? Right? And then the other industry that really had a lot of misinformation, depends on the industry in this case was the one that was spreading the misinformation, but was the tobacco situation where it took a long time for people to become convinced that tobacco was bad for you because the tobacco companies were out there with fake experts that they hired to cast doubt on the results of the studies. And I love that example because what they say for this pre-bunking is if you expose them to the technique that's used in misinformation, right, that gives you a way to open the door into misinformation. And if you use climate change or tobacco or whatever analogy is going to work for your patient that day, you don't have to be in the emotionally charged vaccination information, right? You can inoculate them to the process of misinformation in a place that's safer. Okay. Best possible scenario, create your own myth information, which is actually not a myth, right? Facts, facts, facts. Repeated, well-framed, and focus on safety and efficacy. Vaccines are safer. Prevent disease. It's way more positive than trying to debunk the myth, and it lets you set the rhetoric. You get bonus points if it's catchy. And this counts for debunking too, you start with the fact. You do not start with the myth. Remember, they lose your truth effect. The more times you say the myth, the more likely it's true. Don't start there. Start with the fact. Your fact, and this is, obviously I'm a talker, right? But your fact should not be more complex than your myth, so that's hard for me. I just got this t-shirt, I just found it, it's totally cool, I ordered it on Amazon. Vaccines cause adults. Vaccines cause adults. Vaccines cause adults. Vaccines, it's like shorter than vaccines cause autism by one syllable. Vaccines cause adults. And then the last one, have a nice day. Okay. So bonus points, like if the fact is pithy, but if you just have to say vaccines are safe and effective 80 times to somebody, then just say it 80 times. The best way to protect your child, again, I'm a pediatrician, this works for everybody else too, you just don't you know, the best way to protect yourself is to vaccinate them, right? You are going to need to talk about the myth if you're debunking the myth, right? So the best way to do that, you have to warn them the myth is coming, and that sets them up, right? So they don't hear you say it and they go, well, she even talked about how much this is an issue, right? You don't want them to have that, right? So you warn the myth is coming. You know, there's a lot of social media misinformation out there about vaccines. One of the myths I often get asked about is, right? And you name the myth once, and only once. Because the last thing you need to do is more weight on the illusory truth effect, right? We give, often hear the myth that, so you're setting it up, this is a myth coming, right? We give children so many vaccines that overwhelms their basis. Then you explain how that misleads. You can tell them about how our immune system actually responds to thousands and thousands of antigens every day. You can explain to them, our immune system is stronger the more it sees and learns. A teaspoon, this is my favorite part, like, so there is part of me a scientist, right? An immune response scientist. A teaspoon of an infant's blood has 1 × 10⁶ native B cells per teaspoon. So a naive B cell, rather not native. Naive B cell rate is a potential for making antibody, right? So if you do the math, and of course you have to say it in a way that 1 × 10⁶ is for most of your patients. Now if I'm your patient, totally jive me with that kind of data, right? But otherwise, most people are going to hear it this way. 1 teaspoon of an infant's blood can make 1 million different immune responses today. I think that the 10 in these vaccines is going to be okay. Right? Restate the fact, restate the fact, restate the fact, restate the fact, and be prepared to do this over and over again. Because misinformation is sticky. Okay. All right. There are some things on my phone and watch that I cannot silence. It's going to start dinging. Please ignore that. Sorry, I literally can't silence it. Anyway, okay, so let's, there's one more vaccine delay. Let's talk about this. This was a cartoon, actually not a cartoon, it's a piece of artwork from somewhere around the 1800s, where they were still doing vaccines of cowpox or smallpox. And the artist has this like weird dynamic that we would recognize if we were in that culture. Right now we don't, but apparently this is the unwritten way of saying, if we give cowpox injections to our women, they're going to have sex with bulls and produce half cow offspring. Literally, that's the cultural translation of that image. Okay. All right, here is a seriously tragic, not fun at all fact. Also American though, right? And so I'm trying to give you some juice here for people of different interests. 1730, Benjamin Franklin has a newspaper, and he is very ahead of his time. He is out there, he is telling people there's a smallpox outbreak in Boston, and it killed 1/3 of its victims. Smallpox was no joke. And he observed that of all the people who survived, they had all been inoculated. And he advised people go out and think about this and get inoculated. Literally, 6 years ahead of the next step, which is the tragedy. 1736, there's a local smallpox outbreak. And their son is 4 and he has not had smallpox yet. He and his wife make plans for his son to be inoculated. And the day comes that they're going to go do this because they had to get all this stuff ready ahead of time. It's not like they could just reach in the fridge and grab a vaccine. They had to prepare this like nasty inoculum. So they make plans. They go, and the day that morning he wakes up and his son had what they called the flux, so gastroenteritis. Right? And they were worried that his body would not be strong enough to go through the inoculation process, which at the time was no joke. It actually had some significant risk, substantially less risk than smallpox than the traditional way, but some real risk. And so they decided he was not strong enough, and they delayed. Instead of getting better from the flux and letting them go and get him inoculated, he starts to get over the flux, and he starts to get sick again, and he dies of smallpox. You can't make this stuff up. He gets out there and he tells people about it, right? I mean, I kind of respect that, right? So he gets out there and so he says this, he tells people about it. He says, I long regretted bitterly and still regret that I have not given it to him by inoculation. This I mention for the sake of parents who admit that operation on the supposition that they should never forgive themselves if a child died under inoculation. My example showing that regret's going to be the same. Given that, you might as well take the safer option. And you know what people did? Apparently, colonial America had its own share of trolls. They started rumors that he and his wife had snuck out and inoculated their son in secret, and the reason he died was because they inoculated him. Gotta love it. Okay, so he gets out there and defends himself in public. Fortunately, he has a newspaper. He can tell people about this. And then this is a statement that I can't help. I don't like to read slides, but sometimes you gotta do it, right? Just so it's said verbally, you're reading it not yourself. But surely parents will no longer refuse to accept and thankfully use a discovery God in His mercy has been pleased to bless mankind with. Don't delay. Which ones are important to you right now? All of them. Okay, why not delay? Safety, 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 safety. Right? We have this amazing, incredible, tremendous safety system around our recommended vaccines, and it is designed to test the safety of the vaccines in the recommended schedule. If you change that around, you just rip off that safety blanket and you're sitting out there in the cold, right? Safety, safety, safety. Okay. Also, there may be interactions that decrease efficacy. Vaccines are safe and effective, especially when you do them the way they're supposed to be done. Some vaccines work better at certain ages. We do that with Meninge, right? We give Meninge to teens because they're about to head to boot camp or college or what, their first apartment, whatever it is. They're going to get run down and exposed to Meninge. So we vaccinate them before that happens so they'll have a nice strong response when it does. Okay. So this comes to HPV at 9. I don't know if any of you have been hearing about this. HPV, human papillomavirus. The official ACIP recommendation is that it be given at 11 and 13 years old. So that's where the solid box is in the schedule. This is, I've never seen them do this before, but there's a dotted box between 9 and 11. Okay, because the data is all out there. Again, sorry. The data is all out there that if you start the immunization at 9, things go much better. Right? There's no cost to this. It's actually easier, more than a minute, to do it at 9. And so here, the dark blue bars are the percent of kids who start the series and then complete it. Dark blue, so about half, is if they start at 11. Light blue, so 76% if they start at 9. What is with that? People have been studying this. The AAP now officially recommends that you start at 9. ACIP is not caught up yet, but we're working on it. They do say, ACIP definitely clearly says that 9 is an acceptable option, and it's covered by vaccines for children, and all the other things that make it okay to do, it is okay to do. Okay? 9, just 2 years difference. Well, some people have this 2-arm theory, right? At 11, you get Tdap and Meninge. It's really hard to try and say to somebody, I'm going to give you 2 shots in 1 arm. Okay? That's a 2-arm theory. I like this field because the names for things tend to actually make sense. Okay. There's actually, and people say this and they look at this, it's actually easier to have the conversation about HPV vaccine at 9. 9 is so far away from puberty that parents haven't even started thinking, oh my goodness, never gonna have sex. Right? They can't even picture a 9-year-old having sex, right? So it's easier to say, here's something that's gonna prevent cancer. And the parents aren't gonna say, well, our kid's never having sex, because they haven't thought about that yet, right? It's far enough away that makes it easier. People have actually done studies to show that. And the original reason for having to start later was there was a worry that it wouldn't actually, it would be like Meninge, where the immunity was going to wane, and it turns out that's not true. So there's lots of great data now. Okay. What else? Who won? Somebody say something. Yeah.
The Vax ingredients and Vax cause of disease.
Okay, these are good ones. Close your eyes for a second. It's going to make you dizzy. Okay, vaccine ingredients. So there are a lot of great resources out there. Here's one from the FDA that will tell you all the common ingredients in any particular vaccine. Again, so formaldehyde. There is still some formaldehyde in vaccines. We try and get rid of as much of it as we can, but there's still a little bit out there. But here's your piece of information for that one. Formaldehyde actually occurs naturally in our body. I did not know that. But we have in our body formaldehyde right now, and we made it. It's not like we ate it. We made it ourselves. So in the body of a 6 to 8 pound infant, the amount of formaldehyde that's naturally in their body is 50 to 70 times higher than the upper amount that they could receive from their vaccine series. They made their own formaldehyde 80 times more than the vaccines that were given. Okay. Thimerosal, that's the mercury thing, that's gone. We don't use it. Aluminum is an adjuvant. In other words, it enhances the efficacy of the vaccine. So we can't get rid of that. It's important, right? So aluminum is something you need to talk about. There's actually aluminum in infant formula, if you need that piece of information. And so that is about equivalent to what you get from your vaccines. I'm not all that fan of formula, and lots of your patients probably won't be either, but it's out there. Fetal cell lines is the one that seems to come up a ton, okay? Fetal cell lines are cells that are grown in the lab and have been for decades that were originally taken from a fetus. So probably 10, 15, 20, 100 years ago, right? So there was one fetus 100 years ago. The cells were taken from there and they're grown in the lab. They're immortalized and grown in the lab. So it is true that fetal cell lines were used in the development of vaccines. It's back in the vaccine history. Our vaccines are safe and effective, and if we were to go make new ones up now, it would take us forever and they would not be as safe or effective, right? So I liken it to this. Say you want an organic farm, yeah? You have to start someplace, so you get some seeds. These seeds are non-organic seeds because there are no organic seeds for this particular plant yet, right? You plant them. You grow up the plant. You use all organic techniques, right? You get an eggplant, special kind of eggplant that you're growing, right? You have an eggplant. So is that eggplant organic or not? There's a lot of debate about that, right? I would say that's probably pretty organic right there. But some people say that's not true, and some people who have these officially highly organic farms debate how many generations of eggplant you have to have, because you're going to take the seeds from that eggplant. You're not going to go back to the old, like, chemical-ridden seeds, right? You're going to take the seeds from the eggplant that you grew yourself organically. You're going to get those seeds, you're going to plant them again, you're going to grow them organically again, you're going to take those seeds, you're going to plant them again. Do that for 100 years, right? So that is how much fetal cell line is in the vaccines we're given today, right? So the organic farms are out there. They had to start someplace. They started in a place that we didn't like, but we've been doing it right so long since then that we're in a much better place now. And almost all of them, pretty much all, of the major religions that are out there in the country right now have issued statements to their members of the religion clarifying that the use of fetal cells in vaccine development, remember, they're not used to make the vaccine. They were used in their research 100 years ago that went into making the discovery that allows us to make the vaccine. Right? The fetal cells are not in the vaccine. They're not used to make the vaccine. There are no vaccines out there today that are made in fetal cells. Right, so anyway, the major religions have issued these statements that say the use of fetal cells in vaccine development does not prohibit their use. So if somebody comes to you and say, well, that's against my religion, maybe you guys can find out together, but most of the religions have made these statements. And then again, I give you this reference. Okay, vaccines cause the disease. We all hear this. And you have to decide how much you want to talk to people about this. The big one that comes up these days is mRNA vaccines, right? Because it's going to change my nucleic acids, right? No, mRNA. So here's my fun fact for that one. If you take human plasma and RNA and mix them, and check 15 seconds after you mix them and measure the amount of RNA that's in a test tube, 1% of what you started with is there 15 seconds later. There are a gajillion enzymes in plasma that are taking care of us for this very reason. Our bodies do not like free RNA. It's not a good idea. It's a danger signal, and we digest it immediately. So the RNA is not going to be running around your body. mRNA vaccines for COVID, spike protein will run around your body a little bit, okay? But that happens with any vaccine. So if people are going to get into that level of detail, those are the people you're going to want to make a consultation visit with at the end of the day and be ready. So yeah, that's my thing for that. And then the ones who, this is, how many times, oh my God, how many times a year? I always get the flu when I get the flu vaccine. I don't get that many kids get the flu. This is one of the times, I'm a scientist, I'm an educator, I'm stuck in that body. I think this is one of those times where you just literally have to educate people, right? How do vaccines work? Vaccines work by giving us a small amount of the antigen. Our immune system learns how to respond to it so that next time it will already know. But it has to respond in order to learn, right? yes, you are gonna get some symptoms of a response to an antigen. And that is a sign that the vaccine is working. And you have to have that conversation. The other problem with this, right, is that RSV and paraflu are normally here right now, right? They're late today. We were talking about that before we started. Right now is when we vaccinate for flu. There's a timing link that's not on our side there, right? So you may be in the office getting your flu vaccine, and a kid may cough on you and give you paraflu, and you will go home and have a viral illness. Bummer. That's the best I got to offer. Okay, we're coming up on time, so I'm gonna just some social media and fun pushbacks. So here's my last oldie, 1892. There was a movement in the U.S. to have compulsory smallpox vaccination. I love it. Death is riding the snake and trying to steal your children. Okay. These are more some just examples of pushbacks. My analogy here, for those of you who are old enough to be around during the AIDS epidemic, remember silence equals death. I don't know if any of you remember that. But the idea was that we need to be talking about AIDS. We need to be talking about how you get AIDS. We need to be talking about homosexuality and heterosexuality and drug abuse, right? Because we need to talk about those and bring them out into the open so that people don't die, right? So I feel the same way about vaccine stuff. And I actually, whenever someone says, oh, we don't want to do that, I'm a consultant. I see people, I go see every year a handful of kids who are in the PICU with a vaccine preventable illness. Last year was the first time, actually, I have some gray hair, right? Last year was the first time I was taking care of a kid with pneumococcal sepsis. His mom looked at me and said, tell me, because I'm kind of hearing different things from different people. If he was immunized, would he have gotten this? Oh my God. Her kid is dying in the PICU. What am I going to say? I honestly don't even remember what I said, so I can't tell you, sorry. But I do, all the time, literally see kids in the PICU who have vaccine preventable, and even then, this is not the time to have a conversation about the safety and efficacy of vaccines, right? I mean, like, it's totally not the time, right? Even then, I can't say nothing. I just decided I can't say nothing. And so I'll say something like, by the way, I noticed that so-and-so's not immunized for this or that, or under-immunized or whatever. And a lot of times when I meet people that have questions about that, I actually study that for a living, and I've got the data, and if you want to talk about it with me later, let me know. So I at least have said, I recommend these, and I'm a source of information. I'm not willing to go farther than that when I meet somebody for the very first time with their kid in the PICU. Theoretically, I'm a good doctor, but I like to think I'm a good doctor. Anyway, science equals death. So I think that when we're seeing these things, we maybe need to push back. So all of you have already read this, the irony of anti-vaxxers being in the control group. Okay, so here's, what if instead of a vaccine, we just were able to get exposed to a weak version of the virus that enabled us to build the antibodies we need to fight the real thing? Whoa, great idea. Holy cow. Maybe somebody like Edward Jenner should have thought. Okay, here's the response. What if, and hear me out here, instead of alphabets, we use lines of characters, and then when we put them together, we form them into words. I'm not saying you're going to say this to your patient. This is obviously way too snarky. You may think it, and then say something else to your patient. But if you have a chance at a cocktail party or wherever, I'm not saying you have to put your name and your address and the internet, right? That might be a little scary. But if you're at a cocktail party and you hear somebody whine about vaccines, like, challenge them. Don't let that misinformation be out there. Okay, the Black Plague disappeared without a vaccine. Just saying. Yeah, it killed a third of Europe before it disappeared. You know why it disappeared? It ran out of vulnerable hosts. Literally. Okay, this is one my husband sent me when I was having a really bad day. So true. Did I mention that one of my jobs is to be in a science lab studying immune response? Like, I totally feel it. Okay. And then, no, I know people that got the vaccine and still got COVID. It's a waste of time. Okay, so we're going to wrap it up. So what else we do? So you need to be out there and you need to be immunizing people against social media, right? Great if we had an actual vaccine, but of course then nobody would take it and that wouldn't work. Okay. What else can we do? Participate in IRIS. Make sure everything you do gets into IRIS, Iowa Registry of Immunization Systems, whatever, I can't remember what it stands for, but y'all know that's the online database of immunizations. It makes a massive difference because it helps us prevent missed immunizations. We didn't get to the missed immunizations part, but it is crazy. You know what? If you look at teens coming into a doctor's office for a vaccine-only visit, so like a teen coming in for a flu shot, right? You know how many of those kids are due for another vaccine and didn't get it? Half. That's like almost, but not quite as bad as 10% of primary care providers not agreeing or saying. Okay. Reminder systems, use your medical records, postcards, posters. How many of you have like a pro-vax poster that's designed for kids in the office someplace? If you don't, the CDC is full of them. There are websites out there. There's a gajillion website resources in the slides at the end of this. Pick one, go get one. You can just print it out and hang it tomorrow. Okay. Early conversations. I didn't get into it, but people usually decide, if you are taking care of kids, people usually decide before the baby is born what they're going to do. So get them early. Eliminate missed opportunities, get active. So here's another way to deal with this, and this is in your slides, but if you want to take a picture of this now, I'm going to leave this up for a couple minutes. There is a relatively new organization. It was born in 2019. Finally recovering from that birth trauma. But it was launched in 2020. Sorry, it was born, people put it together in 2019 and it launched in January of 2020. It's called Iowa Immunizes. And what it is it's sort of a clearinghouse organization. So they have brought together all the various different organizations and other folks that are interested in it, in immunizing folks in Iowa. It's a branch of the Public Health Association. And they are just dedicated to improving vaccination rates for all Iowans through education, advocacy, and statewide partnerships. Okay? So I think membership is free. Don't hold me to it, but I'm pretty sure it's free. And they're actually not terrible about spamming you either, but it can be really nice because they do a lot of cool things. They do a lot of community outreach. Right? So if you guys have any community outreach stuff here that you want them to come and be part of, that's great. Or if you want to volunteer someplace, they can let you know what's going on around here. They have a ton of resources. They do games, right? They do these cards, and they do a lot of rack cards in English, Spanish, French, Korean, and Burmese. And if you have a language that you need, I'd be willing to bet they would work on it. So it's great resources. You don't even have to be a member to get these resources. And then they do legislation advocacy. So they have a day on the Hill, which is fun if you ever want to come up and visit the day on the Hill. It's usually sometimes around Valentine's Day. But they have this advocacy alert that will let you know if any big bills that are totally scary are coming, because that is time to really kind of reach out and write. And there's a link on their website to the thing where you can write to your own representatives. Like, it's super easy. So that's another thing you can do. And then I just ran a little late, sorry, but these are fun. The odds of life, right? So a lot of times, and during COVID, I can't tell you how many times I said all these things. We have to remind people that vaccines do have side effects. They do have adverse reactions. There are complications, but they are so rare. I was like I want to go home tonight, right? So I have to get on the highway. I cannot guarantee you that I will make it home safely tonight, right? But I gotta make that risk-benefit decision, right? So we just need to reframe these complication rates. That's what remember that little bear summary thing with reframing? So here's some reframes. 1 in a million, hit by lightning, drowning, becoming a movie star, anaphylaxis after hepatitis B, and that's treatable by the way, and encephalitis after MMR. Now, we do have movie stars in the country, and we don't really want anybody to have encephalitis after MMR in the country, so it's a good time to point out that if you have actual measles infection, you're 100 times more likely. So I like this one, being injured by a toilet. What? I had to look that one up. I couldn't just let that one sit. I literally had to look, how does one get injured by a toilet? No joke. 42 deaths per year from toilets. Most of them are people falling and hitting their head, possibly under the influence. There are the occasional unfortunate toddlers are top heavy, and if they fall in, that's a real problem. But you are as likely to get a high fever after DTaP as you are to be injured by a toilet. Okay. Don't give up. Don't begin with an open-ended question just this once. Don't delay. Don't miss opportunities. Know that you make a difference to your patients, and you are where they need to go for their information, and you have it, and you have the skills, you can be there for them. Know that most refusers are hesitant, and that you can make a difference to them. Use the announcement approach, repeat the recommendation, use your available resources. And we didn't talk about needles, but it turns out, those little like blow noisemaker things that you can get for Oriental Training Committee, where like you get 10,000 of them for $5. That involves that's a kid's version of a deep breathing exercise, right? Because what 4-year-old would not be totally excited to make this noise in the doctor's office? Right? It actually drops immunization pain for that age group like magic. Okay, this article, Strategies for Improving Vaccine Communication Uptake, is outrageously the best resource I have ever seen. And it has all these different things in it. And this is what vaccine success looks like. So my mom was 14 years old when polio vaccine was developed. My dad was 71 years old in 2011, and we didn't get to it, but the grandparent effect is this totally cool thing where if you immunize the toddlers, the grandparents don't get as much pneumococcal disease. Now we immunize them both, isn't it better? I actually just made it under the cutoff. I won't tell you how many years, but I did just make it under the cutoff for smallpox vaccine, and yeah, there you go. Our ideal vaccine situation is the absolute safest vaccine that's out there. There is no complications from smallpox vaccine now. And my daughter was 12 when the day she turned 12 was the day we started immunizing 12-year-olds for COVID. Literally, you can't make that stuff up. That's like a COVID, totally COVID. Like, how many of you have COVID? Everybody has a COVID story like that, right? There's something that happened. Literally. And I said, okay, well, we're gonna start immunizing 12-year-olds, and so maybe a couple weeks after your birthday we'll go and we'll get you immunized. Because I couldn't be the bad mom, right? At some point you have to put the doctor away and pull the mom out, right? So I say this to her, and she says, Mom! And I'm like, oh God. Why can't we go on my birthday? Yes! Literally, she's wearing a happy birthday hat, getting her COVID immunization. So this is what vaccine success looks like. We also need to be out there saying these things. So, thank you. Yeah.
Okay. Are you using the same techniques to get your patients to get the COVID vaccine, or are you putting a little less emphasis on it to get them to take all the other vaccines?
You may have noticed I don't like to compromise.
So all of the vaccines.
However, if I was backed into a corner and someone literally said to me, I would do all of the recommended childhood immunizations and my yearly flu vaccine forever and skip the COVID vaccine, but that's a start. And then I would say, all right, just so you know, we're talking about the COVID vaccine extension. Like, don't give up.
So it's just a question about immunization in schools. I don't know about all the other vaccines, but I know like the flu shots available in schools. So with the lack of immunization in schools, is that a parent thing? Is it a lack of access? Is it the schools not being interested? Like, do you have any comments on that?
The saddest comment, liability.
Religious exemptions and what people are using now.
So, it turns out there are no major religions in the world.
Yeah, I know.
No major religion, let me say this again, no major religions in the entire world.
But they're using.
Maybe there were some before, but they are not now. There are no major religions in the entire world that are against vaccination. This is the rate of immunization certificates, in other words, opt-out certificates. One of the terrible laws that happened this past year, or was it 2 years ago? It wasn't a law, right? They changed the code. They didn't have to actually make a law, so they just snuck this one in. It used to be in Iowa, to get your kid not immunized, all you had to do was sign a piece of paper that said, this is against my personal beliefs, and have it notarized. if you've bought a house recently or done any other piece of paperwork that required notarization, you know that is a major pain in the butt, right? Any barrier to vaccine exemptions is a good thing, right? But that wasn't Iowa law, it was the Iowa administrative decision. So they decided to not do that anymore. Now to not immunize somebody in school, you just have to, you can literally print it out in the parking lot of the school, sign it, and walk in and hand it to somebody. So anyway, these are where the immunization exemptions are coming from. Over the years, you see the years across the bottom. This little tiny yellow bit across the top is medical exemptions. Those are real. Okay, so that's like less than 1%. Invalid or no certificates, those are the kids where there's immunization in school programs. If we could get those back, that would be awesome. These are the kids that are just like behind, and the nurses at school are kind of like, they don't want to like get the kid out of school. That'd be awful too, right? And so they kind of just keep, you know, you have to really empower the school nurses to really like go after those folks and really give them information on what they can do to get their kids immunized. Because those are just the like, I missed it, right? Blue are provisional certificates, which are where the school nurse has gone after them, they can't do anything about it, so the school nurse signs off on it. So red and blue, not cool. We can do something about those, right? Dark blue are these religious exemptions, which in Iowa are personal belief exemptions. And I put this yellow line here because that's 95%. Remember 95%? 95% is what we need so that we don't actually have circulating measles in the US anymore. So Iowa is now, since, where did it happen? Somewhere in here, no, actually it's been that way for a while. No, wait, there it is, right here. 2021, we crossed the line. It is not possible, given the number of kids who are not immunized in kindergarten, it is not possible for us to reach herd immunity at the moment. So yes, religious exemptions are an issue, but they really are not religious, they're choices. And I would play that up as much as possible.
I really feel like the government is kind of tying our hands behind our back on some of this, as far as they're letting chiropractors sign the school physicals, and then they're allowed.
Are there chiropractors in this society? I need to know before I go there.
They're very anti-vax, and so they're handing off the.
Chiropractors are anti-knowledge. Have you ever gotten into a conversation? I'm gonna go with there aren't any in this society. I hope there aren't any room. Please tell me there are no chiropractors in this room. There are actually great chiropractors out there. That's actually true. I'm not just saying that because you might be a chiropractor. Chiropractors are really one of the biggest misinformation problems.
Yeah, especially in Davenport, it's Palmer.
You have a special one.
But the other thing is they've changed the IRIS form this year too. It no longer prints the HPV or the hepatitis A. You've got to go in and specifically look on each kid to see if they've had that done elsewhere. It's kind of a pain in the ass, quite frankly. It just takes that 10 minutes more to find the stuff and print off the second page. I just feel like it's really against us.
It is. It totally is. It totally is against us. For IRIS forms and all the other pieces, that's where Iowa Immunizes can be a great resource for you, because they can put all of us together and really advocate. They've got, they're a branch of the Iowa Public Health Association, and the Iowa Public Health Association actually has a person on salary as their lobbyist. Excuse me, we can't lobby in public health, we advocate. They have an advocate, advocacy expert. They've got these people that in Iowa Immunizes, they spend all sorts of time in the Capitol and all the other places. They can be your voice on this. And you don't even have to join. If you just have something like this, and I'll take that one back because I work with them all the time. But if you've got these issues, bring them in, send them to us, let us know what's causing you to break down, because 10 minutes is a lot of time.
I literally had a patient tell me last week that they paid $50 for somebody online to give them a religious exemption certificate so they continued to be a nurse at the hospital.
They paid for it, that should be legal.
They paid a minister to get it.
Vaccines are safe and effective. Vaccines are safe. There are these people that you aren't going to be able to reach, but they are 2%, 2 to 5%, right? They're the ones that hurt the most, and so they're the ones that take, I don't know how many of you have been through some of the wellness stuff we talk about now about moral injury in medicine, and that is absolutely 100% the moral injury of the whole situation, right? That somebody would go that far to not protect themselves, right? I feel it, right? So, but take just a minute and give yourself credit for the other 40% of people who were hesitant and are now immunized because of what you did. And it doesn't feel that way, all right? But I'm here to say every single one of you has probably saved somebody's life by immunizing them. I'm not blowing smoke, I'm not joking. If you run the numbers, this is true. So, I would like to take a piece of your pain for your person with the $50 certificate. Misery shared is divided. But I really do want to say thank you to all of you, because even though it's so easy, well, right, it's like so much easier to remember this, right, than the lives that you've saved, because you don't know that you saved their lives. Public health, when done right, is invisible. Just think about that for a minute, right? And this is part of public health. But you have done so much good. You really have. I totally mean this. You have done so much good, and you are going to continue to do so much. Tomorrow, you're going to do good by somebody. So, yeah. We need to keep our voices loud and heard and advocate. If you don't want to do IMUs, I totally don't care if you don't want to do it, but advocate somehow or other, right? People don't, like our position as physicians in our community, it actually puts us in a position of high respect. When I go to these Iowa Day on Health, it's like eye-opening. People are like, oh, Dr. Wellington. I'm like, like inside my head, I'm like a 14-year-old on the hill, like going, oh. And they're like, oh, Dr. Wellington, I want to get your opinion. Like, whoa, okay. We are actually, by default, we have some gravitas still in our community, and that hasn't all gone away. So use your voice. Yeah.
So I'm pretty sure I'm the oldest guy here, and you're always good for telling how it used to be, but we actually have to go back before me. When I entered medical school in my program in 1981, my father, who was a very well-respected hematologist and oncologist who had graduated from Ohio State in 1948, School of Medicine, conveyed me his doubts about me going into medicine in 1981, and he said, oh, medicine's not like it used to be. I like the days when my patients did what I told them. Okay, so that's 2 generations ago. I'm glad to see we're getting back to the old days.
It makes a difference. It doesn't feel like it. The announcement approach, if you're not already doing the announcement approach, before you start doing it, spend a couple weeks practicing. I cannot tell you how many announcements I have screwed up, right? Just like trying to say them and the words don't come out. Write them down, do whatever you need to do. It will change things. And not only the announcement approach, right, but that second, I need you to know, I hear your concerns, I'm happy to give you the information you need. But this is the most important thing you can do to protect your children. I strongly recommend. If you have a relationship with that patient and you know that it's going to help, this is what I did with my child. This is what I did with my body. This is the extent, the things I went through to get myself protected or my daughter protected. Tell them this. If you've got people who are like, oh, the flu always gives me the flu vaccine, always gives me the flu. First off, actually, have you ever noticed that there's a big sign outside that says flu clinic? It's like, are we actually going to get the flu or the flu vaccine? Just saying. Anyway, if you need my story about my daughter, and that's okay, Mom, you're healthier than you were yesterday, you take that. Right? But we need to stop sneaking into the room. We need to stop hiding the vaccines. We need to celebrate what they're doing for us. And we need to tell our patients that they need to do this. And then listen to their concerns.
So, if your kids are vaccinating, and if we start having more measles outbreaks, will there be a point at which
So, checking titers is one thing you can do, but it actually is completely safe to just give another dose. And it depends on the person, I think, which way you need to go there, but a lot of people are like, well, if I have a needle to get my blood drawn, or a needle to get the shot, just give me the shot. And usually the public health approach during an outbreak is to do what we call ring vaccination, and you actually revaccinate everybody. Two doses is like 96+% effective, but when you're in an outbreak, that R0 is so high, so stinking high. And remember, those outbreaks tend to be in these clusters of under-immunized populations, right? The story you often hear, and I apologize for like the stereotype here, but if someone's on a mission trip, right, and they come back to a group of people who have a set of shared beliefs, and I'm not picking any particular shared beliefs, I'm really not trying to do that, but there will be these groups of people with these shared beliefs about this whole vaccination thing, and then they travel and they come back and their whole community is in trouble. And that happens over and over and over again. It's just I'm saying that not as a piece of prejudice, but as a piece of epidemiologic phenomenon, okay? So you just go in and everybody that's around them, you vaccinate. And some of the people, I mean, the dirty secret of the whole thing, right, is like, if you have a massive exposure, right, even if you had your 2 measles vaccines, you might still get measles. It's not very common. And if you do get measles, it's almost always a relatively mild case. But yeah, it's usually easier to just re-immunize people than to actually do their titers, and cheaper. 1957 is the magic age. Theoretically, if you were born before 1957, theoretically you're immune. But again, if you were born before 1957, that means you're at the age in which your immunity is waning. So, some choices to be made. Thank you all so much. It's been awesome.